Rising coronavirus cases have put local and state officials on alert.
Governor Abbott addressed those numbers yesterday, and while discussing how to stop the virus, a second state shutdown seemed to still be on the table.
Closing down Texas again will always be the last option.
With cases soaring across Texas, some hospital systems are discussing surge protocols. Channel 2's health reporter Haley Hernandez in our newsroom this morning. Haley, how do those protocols work?
Hey, good morning, guys. So it means that if we don't reverse this trend, the Med Center may be at risk of running out of ICU beds in 2 weeks, in which case they would move to the surge plan. A surge plan is a plan to expand available ICU beds above normal maximum levels, and that's about double what they can handle right now. But that has to be reserved for temporary aid. It is not something that can be sustained. Houston's fire chief says the surge in hospitalizations also has a domino effect on first responders and the rest of us.
When our ambulances are waiting at the hospitals for an hour plus, waiting to transfer the patients because the hospitals are saturated, that has an impact on us being able to service the next call for service, the next emergency call. And that has a domino effect on our capacity.
Now, this is disappointing because we had been successfully flattening the curve and keeping hospitalizations low, but state and local authorities say this month we started moving fast in the wrong direction. Now, here's a look at the numbers that are so concerning. On Memorial Day, we had 311 coronavirus patients in general beds and 198 in the ICU, but we have tripled the number of patients in general beds and doubled the ICU patients. Yesterday, we also learned there are more than 3,700 patients statewide. That's a new record, and it comes as the state's positivity rate also continues to soar. As of June 21st, the state's coronavirus positivity rate has reached 9.51%. It is possible as many as 8.7 million Americans came down with coronavirus in March, but more than 80% of them were never diagnosed. Now, remember, that was early into this pandemic. Actually, that was before we even called it a pandemic. And as you know well, we did not have adequate testing. However, the CDC recently studied a surge of flu-like cases that were reported in March, which was just people complaining of fever and coughing, which now doctors say is further evidence that the virus was here before we knew about it. It was possibly sickening and killing people under the radar as early as January. So Lisa and Andy, you may be asking why that's important to know now. I was just talking to a UT Health doctor not long ago, and that would really provide some answers to families who maybe lost a loved one early in this year to some mystery virus, if they can prove that coronavirus was here that long ago.
My goodness, a lot of answers still needed on that coronavirus front. Just getting started. Haley, thank you.